Hello, my name is Emily Williamson, and I'm going to be presenting my applied practical experience. The project sought to define the importance of child care subsidy and how it relates to public health and the listed competencies selected. The purpose was to show the effectiveness of a new application format and the benefit of implementing the universal income standard. The location was with the Department of Children, Youth, and Families on the west side of Washington. My site supervisor's name is Rebecca Plett, and she's no longer with the department at the time of the submission of this project. My role as a student was to research the effectiveness of a streamlined application process and adjustment to procedural Washington administrative codes to support new application formats and universal income standard for eligibility. The activities that coincided with the work products for this project were a presentation to the policy team after receiving the survey results. 500 clients were asked the survey questions. The final survey and poster in the presentation here at the end were used to present to the policy team. This included a research element to present findings from the weeks I worked to support the assertions regarding the benefits of a universal income standard and an improved application method. Program leadership, such as my boss, Rebecca, and my lead, Trisha, were used as support, and they were used as valuable resources. Work Product 2 was a final proposal for 6 policy changes. The logic model I provided lays out the inputs, outputs, and outcomes. The primary project was a new application format and updated client portal with instant document access from clients. Support was provided by team leadership with messaging to direct leads for questions, and any anticipated outcome would hopefully be the acceptance of the new application format and the 6 policy procedures that we submitted to the team for approval. The secondary project was being a proponent for the universal income standard for eligibility purposes. This would greatly improve the health of surrounding populations for people who depend on child care subsidy and other public benefits. This would work in tandem with department leadership to facilitate these updates and to present to the legislature for the next session. The activities described connect to the following competencies in the following ways. Due to time constraints and business needs, the project was completed asynchronously, primarily by me. Research took place during the allotted time during the workday with the assistance of program leadership. Throughout the project, communication stayed open via department email and Microsoft Teams. Supervision was limited, and the communication was mainly used for approval purposes for the policy items I was drafting. The timeline and due dates were based on the availability of the policy team and the legislative session schedule. I selected CEPH 4, 7, 11, 14, and 9 to analyze for this project. For CEPH 4, in support of this project, we used SSPS data to access population-specific details. Quantitative and qualitative data were used in the form of a questionnaire in which results were based on the data provided from 500 respondents. This supports this competency by using data provided by Washingtonians who access this public benefit, providing metrics for the project. Using specific data from the surveys allowed final fine-tuning of the submission to the policy team, and the final work product to support this competency is the use of the survey data, which was used to draft the final submission to policy. For CEPH 7, with all the data considered, the connection to CEPH 7 is as follows. The built environment for children can impact their health outcomes. By being able to assess population needs, assets, and capacities that affect community health, we were able to streamline the application process and make a determination of eligibility based upon less time-consuming processes and allowing for less burden to the client. Per policy, the verification procedures must be followed to verify all the client's information, which can be especially burdensome if the client is self-employed or works an on-call schedule with no set hours. This is not a client-centered policy, and as such, during phase 2 of the problem identification stage, the option of using alternative verification methods that require direct documents from the client were brought up to use, such as the IRS data retrieval tool, which is used on applications such as the FAFSA for higher education. The final work product that supports this competency is the final submission to policy. CEPH 11. When the site for the APE was selected, the planning process began on my part. The agency initially identified the pain points of CCSP via meetings on Microsoft Teams and further identified them after asking 500 respondents the survey questions attached. A total list of 40 action items was initially submitted to policy. A response was received with instructions to select only 6 of the utmost importance to submit for final approval. The final 6 items will be gone over at the end of this presentation. We also used the social vulnerability index from the CDC, which was a guiding principle during the applied practical experience. This helped to emphasize the importance of a revitalized application process, which would allow even more Washingtonians access to the program. For CEPH 14, as covered in the ILE report I submitted, the adverse health impacts of a lack of social equity via childcare subsidies are evident. By approving the proposed changes, these impacts could be statistically reduced. Childcare subsidy is as impactful on one's health as quality health care. The early years of child development are crucial to lifelong health. A comparative study in Europe was used as supporting documents for the proposal to the policy team. The 5 programs assessed were the Family Network in Austria, Prolepsis in Greece, Sure Start Hungary in Hungary, which was a program for teenage mothers, Toybox in Northern Ireland, Eager and Able to Learn, also in Hungary, which is a great program, a Mother's Club in Romania, and Theotokos in Romania. The focus group in the European program included 6 to 10 respondents with similar income levels, ages, and jobs. The sessions lasted for 45 minutes. We kind of used this data to tailor the program here that we're describing. These programs are framework for programs that could be implemented in Washington to address unmet needs, such as childcare. The final work product that supports this competency is the survey asked of 500 respondents. And finally, for CEPH 19, midway through this project, the leadership team received a presentation discussing and fine-tuning the final program submissions. Policy advisors who presented to the legislature also gave their input on project goals. After completing the allotted hours during the APE weeks, the final focus areas of the universal income limit and an updated application became the primary focus. The perpetuation of systemic inequities through policies that are not population-focused and using the 60% state median income as the limit for first-time applicants is no longer acceptable. Coupled with stagnant wages, the cost of living has created an unsustainable living and working environment for many Washington residents, which is what this project hoped to address. Thus, this competency was addressed with the submission to policy to redirect focus and increase the number of eligible families. The final submission to the policy team included 6 action items. Those action items are as follows. Simplify eligibility by creating a universal income limit. With $50 billion in extra funds, the expanded access should be a priority for the next legislative session. Add a disclaimer about immigrant families that immigration status is not considered or reported at the time of application. Create an online platform that allows clients who do not speak English to apply online in their native language, reducing access disparity. If the next legislative session cannot approve a universal income standard, increase the income limit at application to 75% of the state median income instead of 60%. In the following legislative session, the requirements for ESL students to work at least 20 hours per week should be eliminated, as most people who cannot speak adequate English cannot maintain employment or even get employment. We should also additionally, the final item was to petition the IRS to use the data retrieval tool for income verification, which would reduce the client's burden. This flyer goes over the second part of Work Product 1, which was presented to the policy team as justification for the 6 items we were hoping for approval. The Child Care Subsidy Distribution Equity Questionnaire included 16 questions, and this was included in Appendix B of the final APE report. There were demographic questions about age, gender, racial identity, and income. Also sought to figure out what language they speak primarily in their home, and also asked them to provide any additional comments or suggestions if they had any. In summary, this project really helped me to focus on what was important in childcare subsidy and how I can incorporate that with my public health knowledge. It was rewarding and fun to incorporate a project for my master's degree into my daily work, and knowing that I contributed directly to improving health outcomes and increasing access for needy children was great. This is particularly close to my heart as I grew up in poverty. I know the toll living in poverty has on mental health, and being able to combat this issue is near and dear to my heart. Being culturally sensitive and adaptive to different language barriers was also crucial in completing all activities for this program. Interpreter services were having technical difficulties for several calls across the duration of the APE, which increased call times and took time away for data compiling. Regardless, due dates were met and the data needed was received to complete the program goals listed herein. Additionally, the daily requirements of the usual workload added constraints to the project. It was crucial to work in tandem with regular business need tasks and create a space to complete the action items for the APE. In summary, this experience showed the areas of attention that public health professionals are not as focused on, that require more attention and funding to improve current programs and operation of them. The practical skills that I took away from this process were data planning and analytics, communication, and cultural competency. As the survey results were received and the data analyzed, planning began. During the development of the survey, several different conversations focused on how to develop a survey and which data needed to be collected were had. This helped to fine-tune the importance of what data we needed on the survey. Communication was consistently free-flowing, and because of the 6-week time constraint for data collection and strict deadlines for both class assignments and policy meetings, we relied on email and Microsoft Teams chat. When concepts were too complicated, we met via video on Microsoft Teams. Cultural competency, the tailored surveys were included with simplified language, as literacy levels vary, especially with many different language speakers. Much preliminary research was based on marginalized groups, and different levels of access to education were also considered, giving consideration to refugee families. In closing, this was a great experience, and I thank you so much for your time.